I'm going to be doing a IV medication with a piggyback. I'm going to come in and first I'm going to check the physician's order and verify the correct medication. Make sure there are no allergies. We're going to be administering Rocephin, 1 gram IV daily as directed over 30 minutes. What's available is 500 milligrams per milliliters, which gives us 2 milliliters of Rocephin. The rate is going to be 17 drops per minute. The safe dose is 1 to 2 grams once daily, and the action is that it binds to bacterial cell wall, causing cell death. Cephalosporin, 3rd generation. The treatments for this treats UTI, skin infection, and respiratory infection. The side effects are GI upset, fever, and the contraindications are if the patient is allergic to penicillin, cephalosporin, they can't hang this with a calcium IV. If the patient has hepatic or renal disease, and if they're anaphylactic, pregnant, or breastfeeding. We want to make sure that we assess the liver and kidney function, the labs, the AST, the ALT, and the BUN 7 to 23, and creatinine 0.6 to 1.2. So first I'm going to make sure my hands are clean, and I'm going to get the medication ready. I'm going to clean and double check my Rocephin and expiration date. I'm going to clean and I'm going to pull back 2 milliliters and inject the 2 mils of air. Alright, we have 2 mils. I'm going to recap. And now I'm going to grab my piggyback, the sodium chloride mini bag, and I'm going to make sure I have a clean port. And I'm going to inject the medication inside the bag. Okay, I'm going to take that out and recap. And I do have my the card to figure out the drop rate. It's right here. Okay, so the medication is now in the mini bag. I'm going to make sure the contents are all shaken up and mixed together. And I'm going to put a label on this. I'm going to make sure I have the drug, my initials, the date, the time, the expiration date, the patient's name, and the flow rate, which is 17 drops per minute. So I'm going to leave this here. Bless you. And I'm going to get my tubing, and I'm going to attach this to the mini bag. So I'm going to make sure that this port is clean, as well as this port. I'm going to connect the tubing. And I would now label this tubing so that anyone knows that I was the one that hooked this up. I'm going to get this situated up here. And before I unclamp this, I'm going to wash my hands and identify the patient. I'm going to identify the name and date of birth. The patient has no allergies. And how are you feeling today, Mr. Smith? Good. I'm Lexi. I'm going to be administering a piggyback to your already IV that you have. And so now I'm going to make sure that I'm not going to put clean gloves on yet, and I'm going to really quickly make sure this is all primed. So a trash can underneath me. Okay, we're good, we're primed. I'm going to just set that right there. I'm going to clean my hands, put on the clean gloves, and now I'm going to grab an alcohol wipe and make sure there is no inflammation or phlebitis. The site looks good. There's no pain, right? No pain? Okay, good. So now I'm going to connect the piggyback to the primary. So I'm going to make sure this is all clean and this port is all clean. This is hooked, and since this port is above the primary clamp, I do not need to clamp it. I will, however, need to unclamp the piggyback, so I'll unclamp that, and I'll go ahead and set this at 17 drops per minute. And I'm going to assess again the site and make sure everything looks good, that the patient's not having any reaction or inflammation or redness. I'm going to get all of my stuff cleaned up and let the medication run for about 30 minutes. I'm going to take my gloves off, wash my hands, dispose everything in the sharps, and really quickly before I leave, I'm going to make sure this is set below the piggyback. So everything's good. That's going to be set for about 30 minutes. I'm going to make sure the patient has their 4 Ps, the positioning, the pain, to the bathroom, or any possessions they might need. I'm going to leave. I'm going to come back in. I'm going to observe the infusion, make sure it's completely gone. I'm going to clamp the piggyback that is empty. And I'm going to wash my hands and apply clean gloves. And again, make sure there's no redness or inflammation. And I'm going to go ahead and remove this. I'm going to put the primary bag back up. And aseptically, I would remove this as well. Dispose of my stuff. And I'm going to, this is already unclamped, so I'm going to make sure that it is set at what the physician had ordered before, and that's 100 milliliters per hour. I'm going to get all of my stuff cleaned up, put it away where it goes. I'm going to apply the alligator clamp if we had one, but we do not have one. I'm going to again assess, make sure there's no allergic reactions. And after I dispose of everything, I'm going to document in the MAR the time, drug, dose, and route. And I'm going to state the condition of the IV site, which everything looks good. And I'm going to record on the MAR the intake and output. And then I will obviously make sure that the patient is not in pain, that they are in position, and that they have their possessions and they don't have to pee.